Hello everybody, you're very welcome to this session on exercise and heart disease. My name is Karen Craddock, I'm a specialist cardiac physiotherapist. So when we look at exercise, there's a couple of different things that we need to consider. We look specifically at physical activity and we look then at exercise in a more structured way. So as we know, physical activity is movement carried out by the muscular system that requires energy. So any bodily movement at all. So that would include washing the windows, the floors, preparing meals, standing rather than sitting. So that's all physical activity. But when we look at exercise in a more structured way, this is a planned activity. It's intentional. We use repetitive movements and it's very much goal orientated. So exercise develops your fitness levels by challenging your cardiovascular system and also shows some adaptive changes. Examples of this would be swimming, resistance training, cycling, walking. So our next question is, why should you exercise if you have heart disease? So we know up until relatively recently, 10 or 15 years ago, you were asked to stay in bed following a cardiac event. However, science has advanced considerably over that time, and we now know that exercise is an inherent part of the rehabilitation journey following a cardiac event, starting as early as possible with your exercise training. So we know that exercise alone can reduce your risk of a further cardiac event by as much as 31%. We also know that you might have had considerable interventions and are on a considerable amount of medication following your cardiac event, but exercise actually is a singular intervention that will make the greatest difference to your quality of life. So how does it work? So it's quite complex. So how does exercise actually work in helping heart disease or helping you recover from your cardiac event? It's almost counterintuitive as to how, when you exercise train, that your blood flow to your coronary arteries should improve. So we see here, these are your coronary arteries here on the right, and we start to see with these, this is just a shot of an angiogram. We start to see that the coronary arteries here are what we see the blood flow going through those. So if you have heart disease, there's some level of restriction within that blood flow. And even though you might have had a stent in some area, there might be patches of coronary artery disease in the other arteries as well. So what you're looking at really, if you go over here to the slide on the left, we start to see, when does coronary blood flow occur? So when do the actual arteries get their blood flow? So we know that with each beat of the heart we get a contraction, and that's followed by a relaxation phase. So it's like a squeeze of the heart and then a relaxation. So the technical terms for those are systole and diastole. So we know that as the heart is squeezed during systole, that we're actually going to reduce blood flow to the coronary arteries. And then actually during diastole, so during the relaxation phase, so that nice, relaxed phase of the heartbeat, we know that actually the coronary blood flow is more enhanced. So what happens then when we exercise? So we know that with exercise we start to see the heartbeat increase, and actually in response to that we start to see that the actual time in relaxation reduces. So how are we going to affect coronary blood flow during that time if diastole is reduced? So there's lots of mechanisms that occur, and they all need to be considered in your exercise training. Okay, so if we move on here, so if we look at the coronary arteries, we see what we want to do is increase the diameter of the coronary arteries so we get more blood flow through that. And the way we do that is actually through this nice shearing force on the wall of the artery. And what that does is it releases this nice product called nitric oxide, and that actually is a powerful vasodilator. So in fact, when the blood flow during diastole occurs, if we get this nice widening of the artery, or vasodilation, which is another word for that, we can actually get more blood flow for less time in that relaxation phase, and that certainly enhances the coronary blood flow during that time. But for yourself with coronary artery disease, what you're starting to look at is that if you decide you're going to go out for a walk at a high pace, that the coronary arteries aren't ready for that. So it's important that you're actually getting a slow release of nitric oxide over a period of time before you go into your intensity work. So this is a warm-up, so it's a graduated warm-up is important. So we start off nice and gradually, and then over a period of 15 minutes we complete the warm-up. So this is graduated over time, and the purpose of that really is to enhance the widening of those coronary arteries. So it reduces any risk of event during your exercise session. We also see with exercise training that we get some adaptive changes in the muscle, and this is important. So you know that during the period of time of your cardiac event, we get a diversion of blood flow away from where the blood is not hugely necessary during that time. So that would be to your muscles in your arms and legs. So for that reason, you might have felt a little bit weak getting out of bed the day after your cardiac event, depending how long you were in bed. But we do need to start to work up that muscle to see how we can make things more efficient. And in making things away from the heart work more efficiently, we can actually offload the work of the heart and reduce the risk of further cardiac event. So we have a nice diagram here. So this actually follows how you produce energy. And in fact, you know, following your cardiac event, you might be feeling quite tired. And really what that means is that you're not producing enough energy down here in the mitochondria, which is where we produce energy in our body. So really we start off by taking oxygen in through the air over here, through our lung tissue. And quite often after a cardiac event, you might find that your breathing control is not what it used to be. So we see an inherent reduction in what we call the volume of breath you can take in during your breath cycle. So some nice breathing exercises can offset that, or we might need to start to look at some inspiratory muscle training for you. That's just to optimize you getting the oxygen in through the ventilatory system. So we look at the circulation then. So this obviously the heart is part of that, as well as the coronary blood vessels. But in fact, your circulation around your whole body is part of this circulation system. And in fact, after your cardiac event, you'll find that those arteries are quite sluggish. So they take a little bit of time to react. So we know that if we can optimize that or improve reaction time and improve the capacity to widen the arteries or vasodilate, that will start to improve your performance. So you'll start to feel better. And in fact, in doing that, what you're starting to look at is you're actually reducing the workload of the heart, because you're manipulating other aspects of your energy production system to improve your capacity to do work. Okay, we then look down at the muscle tissue, and this is where we need to start to work on some of the strength work. So this will actually, strength work will actually improve the number of mitochondria that are available to produce energy and the capacity within them to actually produce energy. So when we look at what type of training you need to be doing, we might need to have a look at your ventilatory system to start with. Certainly we'll have a look at your circulation system, see how well that's operating, and where we can manipulate that with exercise training. And that would be really aerobic type training or cardiovascular training. So using a large muscle groups in your body. So that would constitute walking, swimming, cycling. And then the last piece would be to introduce some strength work there as well for you. So it's important that we're getting all the components of exercise in your regime so that you're optimizing performance, and in doing that you're actually offsetting some of the workload of the heart. So the correct way to exercise. So when we look at exercise, we look at the FIT principle. So we look at the frequency, which is 3 to 5 days a week. Your intensity, show moderate intensity. Remember what we said earlier about getting those coronary arteries nicely widened. So you need to warm up for 15 minutes, and that's a graduated warm up. So starting off nice and slowly, graduating that up over a 15-minute period, changing your pace every 3 to 4 minutes. So ultimately at the end of the 15 minutes, you're actually able to walk, talk, but unable to sing at the same time. And we will, you know, if we have exercise tested you, we will be able to get you some heart rate zones, and also we'll be educating you on the Borg scale. So the time, so we're looking at 20 to 30 minutes in the conditioning phase, and in fact that can go up as much as 60 minutes eventually. But we do need to include a warm-up of 50 minutes, as we said, and also a cool down is important. So during your exercise session, you get this release of noradrenaline and adrenaline, and that's important because that helps you raise your heart rate in response to your activity, but it also can cause some little arrhythmias of the heart. So in order to offset those, we need to cool down. So that, again, as we spoke about in the warm-up, with a graduated warm-up, we need to work on a graduated cool down as well. The type of exercise, so what we've spoken about really here already is the cardiovascular type exercise, but we also need to introduce some resistance work. So we said with frequency, with the cardiovascular work, it needs to be 3 to 5 days a week, nicely structured. Your intensity, so your intensity is important as well. So we know that there is an optimal zone that you need to work at. And when we look at energy production, we talk about this this term ATP, so adenosine triphosphate, and that's what you're producing from your glucose molecules. And the most efficient way for us to produce these ATPs is actually within our aerobic zone. And we know that the zone, if we set that correctly for you, is actually 40 to 70% of your heart rate reserve. So this is actually below where you start to build up waste products again, but is very specific for yourself. And certainly with the exercise testing, we'll be able to highlight that for you and get you at the right zone for your time frame. So that's all calculated from an exercise test. So the time, this is what we looked at already. So we start off nice and gradually with a warm up here. So this is your 15-minute graduated warm up. We're looking really at 20 to 60 minutes at this intensity. So you're able to walk, talk, unable to sing, and then we're going to cool down then for 15 minutes. Now, if you haven't exercised before and you'd like to head out exercising today, we wouldn't recommend that you go straight out and do the 45 minutes. We're going to start off with a 20-minute walk. If you found the session today quite easy or quite tolerable, you can start off a little bit higher than that, but just be mindful that you do need to graduate yourself up. You need to get everything adjusting to an increase in activity, particularly if you're housebound or you've limited yourself to the house. Your general activity in the background will be significantly reduced as well. So just to reiterate, 15-minute warm-up. Our target is 20 to 60 minutes conditioning phase. And then we've got your 10-minute cool down just to flush out the adrenaline, noradrenaline. And then we spoke about the aerobic and the resistance type. So resistance wise, we'll have gone through some exercises with you, but you need to be doing 15 repetitions 3 times a day of the exercises that we've sent you already, and that's important to note. So how do we know what our capacity is with exercise? So it's important that with your exercise you're starting to realize that, in fact, if I exercise train better, I can actually do more things that I want to do, like maybe minding your grandchildren, or maybe I can go a bit further on my hike at the weekend. So those kind of things are important. So the terminology that's used in describing your capacity is a MET. So a MET is a metabolic equivalent, and that's really 1 unit of energy. So as you're sitting there resting nice and relaxed, that's using 1 MET, or 1 metabolic equivalent, and that's the amount of loading that you have on your metabolic system, just to breathe and stay upright in a chair. So everything else is a multiple of that, so every other activity. So when you do your chest or step test, we're able to get a gauge as to what level of activity that you're at, and where you are on that MET scale, and that relates then to general activity. So when we look at general activity, we see, there are comparisons. So just lightly clearing the back garden, we're using 3.5 METs, and then if you're mowing the lawn, it's a little bit heavier, and then if you're doing much heavier gardening work, that's starting to increase your MET loading as well. So after a cardiac event, it's important to get a gauge as to whether what MET capacity that you have, so that you're not overdoing it, because if you're overdoing it on a constant level, you're constantly building up waste products and you're not getting a huge training effect from that. So it's important to liaise with us and just see where your capacity is, so that you can exercise train, and then gradually your MET level capacity will increase. We look at some household chores. So hanging out the washing is actually a 4, which is heavier than most people think. If you think weeding the garden is probably 2 to 3, so that's a comparison there. Moving furniture is quite heavy, so you need to ensure that your capacity is right up at that level and beyond it. And we know that carrying groceries upstairs, so if you're carrying 2 bags of groceries weighing 3 to 4 kilos, that's quite heavy on the MET level as well. So just to be mindful of that. And these are your speeds of walking. So what you're looking at is, as you increase gradient, obviously you're going to require more energy to deliver on that. And then if you're walking at a higher pace, you're going to require more energy for that as well. So we hope that was helpful for you. If you have any questions at all, please drop us an email at info@h2hcardiacphysio.com, or you can certainly join our private Facebook group, which we do respond to queries on that as well. Obviously, that can be anonymous as well for you. So thank you for your time, and we very much appreciate it.